Welcome back to Unmasking the Trans Movement with John Euler. I'm your host, Brad Wilder. Great to have you all along today. We have an excellent show and an excellent guest all lined up. John is standing by with Dr. Dianna Kenny. And today, John and Dr. Dianna Kenny are going to talk and discuss, well, the medical scam that is really affecting children, not only in our country and North America, but around the world. We go all the way to Australia today. Welcome, Dr. Kenny and John. Great to have you on board as well.
Brad, thank you. And we're going to get right into to save every moment. This Dr. Dianna Kenny, she is from Australia, and she came to my attention. I was so pleased to know that I featured her. She did an interview on Sky News in Australia, a beautiful interview, really focused on the concerns of medicalizing gender-confused kids, which are really mental health patients, quite frankly, that are not receiving the treatment. And Dianna Kenny has spoken out. She's been one of the brave ones. She has felt compelled. And so, Dr. Kenny, I'm so appreciative that you're willing to join us from way down under.
Well, I'm delighted to be here, John.
Well, you're a prolific author. You have produced studies. You are an academician. Your heart is both for producing accurate studies, but also you are a therapist. You're a psychotherapist. And we talked prior to the recording and found out we both come from a psychodynamic perspective, which is so important. I think that I'm a little biased, but I think that gives us an additional perspective. We could be a behaviorist or a cognitive behaviorist, and that's okay. But to really, I think, get at the heart of where the damage lies for these kids, to begin to understand for these wounded young people. And it's important at the outset. Brad, you're from Canada. I'm from the US. Dr. Kenny, you're from Australia. Increasing legislation as far as really draconian legislation that tries to make us sound as though we are anti this or anti that. We're not anti anything. We're just extremely protective of vulnerable women and children. And we speak to those issues that would allow what I say are financial and sexual predators easy access to those that are most vulnerable. Dr. Kenny, that's where your heart lies. Your heart lies in ultimately protecting vulnerable women and children.
Absolutely. And it is the vulnerable who get caught up in these, what we call psychic epidemics. So, whether it's to buy merchandise or whether it's to mistakenly think you can buy a new body, it's the vulnerable who are targeted, and it's the vulnerable who succumb to the virulent advertising and persuasion that goes on in all sectors of society currently with respect to the gender issue.
One of your most recent books, Gender Dysphoria in Children and Young People, really hit at the heart of what is driving some of this. Speak to, again, not just what's in that book, but what prompted you to write that book. And you have many other books. And as a matter of fact, let me ask this at the outset. If somebody wants to contact you, as well as if you have any additional resources, tell us what those are and how can people contact you, so I make sure that we get that into this episode.
Well, I have a website where I post most of my writing. That's www.dianna with two N's, DIANNA, and Kenny, KENNY.com.au. And anybody who wants to contact me privately can do so from that website.
And if, for whatever reason, if they want to contact us at unmaskingthetransmovement.com, we'll certainly pass that communication along to you. Talk to us about what prompted you to write that book about gender dysphoria And then let's talk about your concern about how this really is the greatest medical scandal. I absolutely concur.
Well, there were two prompts. The first one, I was becoming increasingly alarmed by the misinformation that was being spread out across the internet and social media apps and places where young children frequent. But I was particularly alarmed at the incredibly swift uptake of this fallacious gender ideology by people who should know better. And that includes the medical profession, the legal profession, the education department, and other social institutions that are charged with the safeguarding of children, such as the Human Rights Commission, the Commissioner for Children and Young People, the E-Safety Commissioner, and, you know, a whole range of politicians from various political parties, all pushing the barrow of gender ideology. And it was particularly disturbing to me that some of the premier journals internationally and nationally in my country were actually falling in behind the gender ideologists. And I'm referring to journals like Lancet and the Medical Journal of Australia, for example. And it's very disturbing when misinformation like that perpetrated by the transgender ideologists becomes so embedded in mainstream discussion and teaching that it's going to be very, very hard to eradicate. And it's due to the lack of moral courage of people who proclaim themselves to be social leaders, you know, social thinkers. And the only people leading the debate at the moment are the trans ideologists. And they're doing a very good job of it. And the rest of us are playing catch up, and we're a long way behind.
That's right. And that's why I so appreciate your willingness. I mean, I'm in the US and it's getting risky. I've had my, complaints lodged against my professional license, but in Canada, Dr. Ann Gillies is from Canada, very draconian now, and also in Australia. You all really, they will go after you with a vengeance. So that's why, speaking of moral courage, I am very, very appreciative that you're willing to come and speak out. But that's why I want people to know we are not anybody on this program. We are for the protection of vulnerable women and children. And Dr. Kenny, you just referenced, and if you don't mind, I'm going to have you repeat not everything what you said, but I really want, let's say there's a parent listening to us, a grandparent or a concerned citizen. What you just said is so key to have it sink in my estimation. What you said is the major journals that get quoted, right, these sites, that really these formerly trusted sources of information, what we would say is usually reliable research, they have now begun putting forth findings, studies with findings that are skewed. Would that be correct in saying?
Well, they're doing even worse than that. They are doing that, but what's even worse is they're changing basic science about the definition of sex and gender, and seem to be accepting definitions, of gender identity as being either male, female, both, or neither, without ever defining what both or neither actually are or what they actually look like. And this, of all the things that have been going on with this gender debate over the past few years, has disturbed me the most, because my own professional society, the Australian Psychological Society, as well as a whole lot of professional societies in America, the American Psychiatric Association, the American Psychological Association, and so forth, have all drunk the Kool-Aid that sex is no longer dimorphic and that gender trumps sex, that it's how you feel deeply within yourself that defines your sexual and gender identity. And it doesn't seem to have anything to do with chromosomes and genes and DNA. I find that absolutely extraordinary that there are so many millions of people around the world who are accepting those kinds of scientific fallacies unquestioningly. And in fact, you know, are vitriolic in their criticism of people who want to challenge the basic tenets of gender ideology.
It reminds me of the story of the it may be Aesop's fables, or one of the fables, right? The emperor has no clothes. And so, right, this emperor, right, is that Aesop, right, where the emperor supposedly has this, he's talked into by this shrewd tailor who saves money on yarn, or, you know, right, the tailor is so persuasive. The tailor, quite frankly, was a white-collar psychopath with, you know, expert impression management. So he's told this emperor that he's made him such fine clothes that he can barely feel them. Well, meanwhile, the emperor's naked. And so the emperor struts down. I remember reading the book as a child. It's showing this emperor stark naked, walking in procession, and everybody's going along with it. And there's this child was the only brave one to say, oh, the emperor's naked, doesn't have any clothes on. And that little boy who spoke truth shocked everybody in a way back into reality. So we have a situation where, for the first time that I know of, right, that suddenly boys aren't boys, girls aren't girls, men aren't men, women, you know, XY chromosomes don't mean that, don't mean what they mean. And as you said, there's vitriolic responses, so much so that legislation now is passed. If you even dare say that, wait a second, biology 101 doesn't change.
Yeah. Look, I think, you know, that is an apt analogy, and it's been quoted quite often. There was a journalist and author in the mid-19th century who wrote about psychic epidemics, what we now call social contagions. And he actually wrote a book called The Madness of Crowds. And he said that people go mad in crowds, but they only regain their sanity one at a time. And so the social influences and the social contagion that draw people to a particular point of view in the way that cults do, and in the way that this transgender cult has done over the past few years, is much more successful at recruiting participants than people who have tried to extract that group of people from the cult. And you can mostly only do that one at a time with painstaking therapy, which does take time and effort. And that's why we're playing a very difficult catch-up game, because we're trying to combat a propaganda, a terrible propaganda that's been perpetrated in every corner of social existence, and trying to undo that with a handful of people around the world is proving to be very challenging. And, you know, the voices are gathering, fortunately, and there has been some legislation that's been overturned and new legislation that's been put in place that is protecting young people under the age of 18. and here in Australia, we've had a successful challenge in the court to stop a child from being placed on puberty blockade. But it's only one case. And for every case that we stop in the court, there are another 100, 200, 300 children being commenced on either puberty blockade or cross-sex hormones in the same time frame. So it's just a very, very difficult task to undo the damage that's already been done and that's already very entrenched in the collective psyche.
That's extremely well put. Isn't that true? It's the collective psyche. And if you say something loud enough, long enough, boldly enough, everybody eventually, and as I say, and you just said it, as I say is, there was a point in time, I say it's 2005 to be conservative. It's probably 2008 when you look at the rates of referrals. But what I tell people is this: prior to 2005, this didn't exist. And they look at us kind of with deer in the headlights look. And what I say is the only thing that is true about this is it's not real. And then, of course, that's too much, that dissonance that takes place. And I say, well, no, it's real because we're having to talk about it. But prior to the year 2005, you didn't have any reference to trans, and not because there were so many things in place that kept people inhibited or kept people disconnected from themselves. And suddenly it's like a submarine surfacing, the hatch goes up and all these people pour out to find their true self. No, the presupposition is then if we didn't hear anything about this prior to 2005, then all of those of us in the field, all those who taught us in grad schools, all the graduate textbooks, all the research articles, all the psychiatrists, all the medical schools, all the greats, right, of psychology, we must have been brain dead, especially psychoanalytic, right? Those of us from a psychodynamic perspective were pretty adept at getting at the unconscious, helping to make conscious the unconscious, what is driving it. So somehow all of psychodynamic theory, we were really brain dead up until 2008.
So hold on a second, because I've got to jump in here, and this is where the broadcaster in me again comes out. But we looked at this way different back then. We looked at it totally different. The 60s, the 70s, the 80s, the 90s, 2000s. Yes, I agree with you 100%. It changed. But doesn't matter whether you're a psychotherapist or a therapist from 1975 or 1985, whether you're living in Elton John times or David Bowie times, we have a level there of entertainment value and factor, not really understanding the gay side of it for those two individuals, or the bisexual side of that for those individuals. But here we are today, and it's not about playing dress up and going out and entertaining a crowd and singing some songs the way that Elton and David Bowie did it. Now we're talking about something way different, and this is where I believe that the indoctrination comes in, and the grooming and everything that you were discussing. So I wanted to make it clear that while we say this only started in 2005, I take it back, and I'm 55 years old, I take it back to the days when I was looking and questioning, what's up with Elton John? Why is he dressing that way? Why does he act that way? What about David Bowie? What was up with him back then? Ziggy Stardust and all this weird stuff. And, I came to the realization that we didn't really care what they were doing sexually. What we cared about was just that they were providing that level of entertainment with great music. And I believe that those entertainers, while being as flamboyant as they were, they didn't really bring the sexuality in the sense of it being, transgender or wanting to change genders in general. It was about being flamboyant, being different than everybody else. And we accepted all of that. Well, here we are today saying that we accept it still, but now they're forcing it down our kids' throats. So that's where it makes a difference. And, you know, I wanted to make sure that our viewers don't think that this just started in 2005. This has been something that's been grinding in television and in movies and in music and in celebrities for decades. They're always trying to stay in the moment and be the relevance. And the reality is that your time has come and gone, you know. But when you reinvent yourself like Madonna has so many times, and David Bowie and Elton John, we see that flamboyance becomes more and more. And now we're at the point where we have RuPaul with a television show dressing up all these men, and it's celebrated. And I don't believe this is about entertainment factor anymore as much as what other people might still think in their own mind. What are your thoughts on that, Dr. Kenny?
Well, it's a very complex issue that you raise. As you were speaking and mentioning, Elton John and David Bowie, my thoughts went back to Elvis Presley, who completely and utterly scandalized the world because he moved in rhythm to his music. And the very conservative among the population in the 1950s were horrified and scandalized that he was perceived as a sexual being. He was no longer just a pop star because, you know, a lot of musicians before him moved to the music. We just have to think of Chuck Berry's Duck Walk and B.B. King and, a whole lot of rhythm and blues musicians and so forth. But Elvis was an extremely good-looking young man, and the girls went hysterical because he let loose a phenomenon of sexual awareness. And, the elders of the society at that time, their parents, church people, legislators and so forth, even wanted to put him in jail for being lewd. He hadn't done anything other than move to the music. So I think what I'm saying is, and this is what we're seeing currently, is that people who step outside the herd in any way are being chopped off at the legs. You know, they want to be expunged. People who act at the margins or outside what are considered, the rules of decency or the rules of the church or the rules of society have to be marginalised and criticised because they threaten the social order. And the thing that concerns me is that the trans ideology is threatening the social order in a way that Elton John and David Bowie didn't do, even though, and I mean, I suppose you could add Liberace to that list, if you're thinking about, gender expression and so on, but they didn't change the social order. They were people who were very individualistic and they had their own following, but they, didn't create a whole generation of young children who dressed like them, for example.
Exactly.
Or who behaved like them. But the trans movement is threatening to become the dominant paradigm. And this is what we should really be very concerned about, that the scientists are throwing away biological science and, the education departments are teaching nonsense to 5 and 6 year olds. I had a young girl the other day, 10 years old, and I asked her what her gender identity was. And she said, I don't know yet. There are just too many to choose from.
That's sad. That is so sad. I'm laughing, but it's so sad that they've got them that confused.
Yeah. So I think we're dealing with something slightly different. I think you're talking about people who are pushing the margins of acceptability, but the dominant paradigm kind of remains in place. And I'm not saying the dominant paradigm is a good thing necessarily. I mean, obviously it isn't in lots and lots of places, like in Stalin's Russia and Nazi Germany, which, you know, had these very virulent dominant paradigms take over a sane society. And that's what I fear is happening with the trans lobby.
Well, I wanted to show the meaning that it changes from an entertainment factor, gets groomed into us at an entertainment factor and a movie factor and a celebrity factor for years, and then it turns into where we are today. And this isn't just something that started in 2013 or 2005. This goes back a lot farther than that. It goes back to vaudeville days when obviously there weren't enough women in town and they still wanted to have a show at the local theater, and men would put on the dresses and go out there and perform the shows and do the dancing kick leg thing. And, you know, we saw that in the country and Western movies growing up as well. This isn't, but that was, like I said earlier, that's the entertainment side of it. And I wanted to just be able to get your opinion on that, because I think that when people relate, they can listen to all the clinical wording you want, but to understand that what's happened and this transition has been for decades. It's not something that's just been thrown at these kids in the last couple of years, another distraction they call it. You've missed the boat for the last 30 years, folks. That's the reality here. And you pawned it off as entertainment. And entertainment got more and more and more brazen. And as that's happened, here we are, out of control. You're trying to force this down my kid's throat. I'm sorry, but there's my rant for the day. I do digress, Doctor. I need a couch.
You need a couch, yeah. Look, I fully understand what you're saying, that we're, as humans, continually pushing the boundaries of something, you know, whether it's gender expression or our political views. There's always a minority that have what we call extremist views. You know, the conspiracy theorists, the gun lobby, you know, the gaming industry and so forth. So, you know, criminal elements in society are constantly pushing the boundaries of how they can overcome, you know, the laws and the of the land, and some of them do that successfully. And yes, so every time the boundary is pushed a little bit further out, it opens a chink for ever more extreme views to be introduced. And, you know, the aim of the trans lobby is to make their views mainstream. And they've had extraordinary success at doing that. You know, nobody passed legislation about swinging your hips when you're singing, you know, pop songs, or wearing lame if you're a male performer. There's no legislation about that. But now there's legislation to tell parents that if they use their child's dead name and do not use their child's preferred pronouns, they're committing child abuse. I find that horrifying and extraordinary. I mean, I've had cases where young people have been online and been coached about how to get out of their parents' house because their parents wanted to restrict their internet use. So they ring up the police and they give a speech that they've already prepared with the help of their trans online buddies to say that their parents are emotionally abusive. And the police take them to a place of safety, and don't tell their parents where they are. This is what we should be horrified about. It's breaking up families. It's destroying children and adolescents. It's causing irreparable damage that some young people will never recover from. And this is where our focus and attention needs to be, not just trying to restore sanity to each individual young person who declares themselves transgender, but we need to restore sanity to our social institutions, like our schools and our hospitals and our clinics and our legal system and so forth. This is where we should be putting our attention. We need to change the legal precedents. The children are not capable of consent to changing their bodies irreparably under the age of 18. And I question even young people at 18, 19, 20 being capable of making that kind of decision. But currently, around the world, young girls are having double mastectomies because they're absolutely sure that they're non-binary, which is a nonsense, or that they're cross-gender, which is also a nonsense. But the surgeons are doing it. The endocrinologists are prescribing the hormones, and the paediatricians are supplying the puberty blockade. It's a terrible conspiracy of utter reprehensibility on the part of these professionals who are supposed to be safeguarding our young people.
Dr. Kenny, that was so well said. And we're starting to run up against the clock. Would you be willing to stay with us for a second part? Because we have just barely gotten into the meat and the crux of what pulls your heart to speak out as a psychotherapist, as someone who has written about this. You're seeing the social contagion. And I love the fact that you've said so much. We're going to talk about the cult-like element of this. We need to talk about that. And the fact that you called this the greatest medical scandal of our times, I've either read your talking points or you've read mine, and that is not a negative thing. Meaning these are the points that we think are most germane, are most important. So as Brad spoke about the entertainment element, that it started out, a long time ago, and how true is that? We've seen Hollywood just dumb down sense and sensibility and then crossing moral boundaries time and time again. But we've never seen, in terms of those that are quote unquote entertainers, even the ones that have been brought up, notice they never targeted young children. Right? They played to adult audiences, and suddenly now we have these flamboyant men. And I make the case that no man thinks it's a reasonable proposition to dress in women's underwear and drag unless they've saturated themselves in thousands of hours of progressive pornography if they want to access children. Meaning what adults do with adults, we don't cover here. That's not our issue on this program. But when you have a sexually deviant man that is clearly acting out what he's been watching online, and worse, it's usually much worse, what we're seeing, Sam Brinton of the U.S. showed that. Also, the Leah Thomas of the swim team, Penn State, showed these deviant men have a separate side to them than they're showing the public. When we start to see that they're stealing women's underwear and they have all sorts of horrific misogynistic stuff, horrible abuse towards women that they're given thumbs up to, we're dealing with a totally different thing than entertainment. This is a means of targeting and getting one's hands on these deviant men. When I say getting into the private spaces and accessing the private parts of vulnerable women and children, and that's why it's such a concern. Dr. Kenny, would you stay right there? We're going to let Brad close us out for this part of the program, and we'll pick it up at this point on the other side.
Thank you very much, both of you, for being here. This is Unmasking the Trans Movement with John Euler. I'm your host, Brad Wilder. Dr. Kenny is on her way back in part 2. This is another episode you just don't want to miss. We'll see you soon.